Alright, hello guys. So today let's go ahead and look at the bones and the joints of the head, the neck, and the face here. So first, let's start with the bones of the skull, and let's look at them broadly here first. So in that, we're going to look at the plates of the skull, the different plates of the skull. So the first one we're going to look at is pretty easy to identify. It is this big plate right here. So this is what we call our forehead, or the plate of the skull is called the frontal bone. So this is the frontal bone, and then again from the side view would be this part right here. So this is the frontal bone. Now the next bone we're going to look at, the next plate of the skull, are the sides of the skull here, the tops and sides as we call them. So it would be this region here, and again seen from the posterior view would be these regions here. So let me see if I can actually make this a little easier, and then we're gonna go doop, boom, and so these are what we call the parietal bones. Let's see. So this would be the parietal bones here. So the parietal being the tops and sides of the skull, the top and side plates of the skull. So the next we're going to look at is the temporal bone. And the temporal bone is here. So you'd see it also here, here, and here. So the temporal bone right here. And then actually this is also part of the temporal bone as well right here, and even this part as well here. So this is the temporal bone, or as many people can easily associate as the temporal region, our temples. Now the next region we're going to look at is the occiput, the occipital region, which is right here, the base of the skull, right here. So let's go ahead and shade that in. This is the occiput, the base and bottom or back of the skull here. Now, all of these plates of the skull are fused together by what we call sutures. Now, there's different sutures, and we're not going to look at every single suture, but we're going to look at some of the major sutures here. So the first suture we're going to look at is the coronal suture. So this coronal suture is this suture right here that bridges the frontal bone with the two parietal bones, right here. So the frontal suture connects the two parietal bones to the frontal bone. The coronal suture connects the frontal bone with the two parietal bones. The next suture we're going to look at is this squiggly suture in between each parietal bone. We call this the sagittal suture. So the sagittal suture, just like the sagittal plane, separates the parietal bones into left and right bones themselves. So sagittal plane, sagittal suture. So sagittal suture separates the two parietal bones here. The next suture we're going to look at right here bridges the parietal bones, one on each side, of course, the parietal bones to the temporal bone. And so this suture is called the squamous suture. So the squamous suture connects the temporal bones with the parietal bones. And then the last suture we're going to look at right here is the lambdoidal suture here. So the lambdoidal suture connects the parietal bones to the occiput. Notice here that essentially all of these bones are connecting to the parietal bones in some way by a suture. So again, just to recap, the coronal suture right here connects the frontal and parietals. The squamous suture connects the temporal with the parietals, and then the sagittal suture connects the two parietals, and then the lambdoidal suture connects the bones with the occiput there. So let's look at some landmarks of each specific area, each specific region of the skull itself. So let's go ahead and, so obviously the frontal region doesn't have much for us to look at, so we're not going to look at any landmarks there. But let's look at the temporal bone. The temporal bone has quite a few landmarks. So one, if we can kind of zoom in without it getting too grainy, is we're going to be looking at this structure right here, this big process. This is a very important process to make note of. So if you actually touch behind your ear, you'll feel this big bone behind your ear called the mastoid process. So highlighted in blue here is the mastoid process. Now, I say that's behind your ear because technically this is where your ear is, or well, at least the canal of your ear canal. So we call this little canal the external auditory meatus. That's the external auditory meatus. Now, this little appendage hanging down right here is what we call the styloid process. And this is actually an endangerment site for massage therapists. We don't want to work anterior to the mastoid process because we don't want to work too deep and then dislodge the styloid process there. The last structure we're looking at is highlighted right in here, right on the sides of this bone here. We call that the mandibular fossa. So remember our words for bony landmarks. A fossa is a shallow depression. So this is a shallow depression for the mandible, which we will look at the landmarks in the mandible here in a little bit. So the mandibular fossa of the temporal bone, and that's going to form a joint for us, a very particular joint, since it's the only joint we'll be looking at in this lecture. So the mandibular fossa. Now, the parietal bones, very similar to the temporal bones, not much to really look at, so we're going to skip some of the landmarks there, and we're going to come to the occiput. So looking straight at the back of the skull, we can see these particular lines. So we have what we call the nuchal lines. So we have the superior and inferior nuchal lines. The blue is going to be the superior nuchal line, and then the red is the inferior nuchal line. So to look at the inferior nuchal line, you can see that there's this particular little triangular dip here. Now, this triangular dip is pretty prominent in most people. If you actually touch the back of your head, you'll feel almost this bump on the back of your head. We call that the external occipital protuberance. Literally boils down to being the bump on the back of your head. So this is a bump on the back of your head, the external occipital protuberance. The rest of the landmarks for the occiput we're actually going to have to look at from this inferior view. So this right here is going to be the occiput here. Now, one, which we saw in the lecture on the spine and thorax, when we looked at the joint between the atlas and the occiput, the atlanto-occipital joint, well, we saw that the atlas met the condyles of the occiput itself. So these right here are the condyles of the occiput, in which the atlas sits on top of and articulates with. So these are the condyles of the occiput that form the atlanto-occipital joint with the atlas. Now, the last landmark we're going to look at is this big hole right here in the center. So this is what we call the magnum foramen, the foramen magnum. Magnum meaning big, foramen meaning hole. This is the big hole in the bottom of the skull where the spinal cord leaves the cranial cavity and runs down through the vertebral column. So the next landmarks we're going to look at are of the face here, so of the bones of the face. Now, first, let's take a look at some of these major and easily recognizable landmarks. One is right here. So right here off to the side, this is the zygomatic bone. And then right here on the side, we would have the continuation of the zygomatic arch, or the zygomatic protuberance. So we call that the cheekbones. The zygomatic bone is the cheekbone. Then we have the ethmoid and the vomer. We're going to look at those together. They're basically the bones that come into the nasal cavity. They make part of the passageway of the nasal cavity, as well as they do form parts of the orbit or the circle that is the eye. So just remember ethmoid and vomer. We'll just say, for the sake of ease and convenience, they're in the nasal cavity, in the nasal passageway. The next area in which we're looking at is called the maxilla. So the maxilla is this region right here, which is basically your upper lip and then, part of your face surrounding your nose. This is the maxillary region. So then the next bones we're going to look at are the nasal bones. There's two of them, one on each side here, and they're right here where the bridge of your nose is. Those are the nasal bones. Now the next bone we're going to look at, we'd have to again switch back here, and we're going to look at the palatine. So right here, this front part of the roof of your mouth is still part of the maxilla. The palatine actually sits at the back of your mouth and is the roof of your mouth, known as what we call the palate of our mouth, the palatine, or the palate of our mouth here. Now, the other bones we're going to look at here is there's a particular bone inside the cranial cavity that makes up a big part of the cranial cavity called the sphenoid bone. So the sphenoid bone is basically shaped like this. This is our sphenoid bone. So you can see it actually has little wings to it right here. And we say the sphenoid bone looks like a butterfly, and it has wings. It has greater and lesser wings. So the sphenoid bone, sphenoid, gives you wings. Now so outside of the wings, the greater and lesser wings of the sphenoid, the biggest landmark we want to pay attention to with the sphenoid bone is this little landmark right here, which we call the ciliae tertia, or translated to the Turkish saddle. Now, we look at this landmark because this is where the pituitary gland sits and basically controls our body. So the pituitary gland sits in the ciliae tertia, or the Turkish saddle, and controls our body. And so, like we said, the sphenoid bone actually forms a vast majority of the inside of our cranial cavity. And you can actually see the sphenoid bone. So this would be the greater wing of the sphenoid right here, right next to the temporal bone itself. Now, the next bone we're going to look at before we get to the mandible is this bone right here, called the hyoid bone. Now, we're not going to look at any of the landmarks of the hyoid bone. The only thing we want to make note of the hyoid bone is that this is the bone in your throat. And the fun fact of this bone is it does not articulate with any other bone in the body. It does not articulate with any other bone in the body. So we know that all bones touch and meet with other bones and make joints and this, that, and the other. Well, the hyoid is the only exception here. So let's go ahead and take a look at the mandible. So there's a few landmarks of the mandible that we want to look at. So first, we have the condyle of the mandible. So the condyle of the mandible is this big projection right here. And that's what's actually going to make the articulation for the joint. So the condyle of the mandible. Now, we then have a word that means projection or an extension of. So we have what's called the ramus. The ramus of the mandible is right here. So this extends upward. So the ramus comes from basically this corner and is basically this, projection right here, this landmark right here itself. The coronoid process here. Seeing that this shape of the mandible here, we can see that there's this little angle right here, and this is what we call the angle of the mandible. So this is the angle of the mandible, or the jaw. So very pronounced in some, and some not quite so much. Then we look at the base. So right here, the flat part, if you were to rest your chin on your hand or on a table, well, you'd be resting the base of your mandible on that surface. So this is the base of the mandible. Then the big bulk of it right here, the big bulk of the mandible right in here, is what we call the body of the mandible. So that's going to do it for the bones and bony landmarks. Let's go ahead and take a look at the only joint in our lecture.
So now that we've seen the bones and bony landmarks here, let's go ahead and look at the joints in relation to the head, neck, and the face. Now keep in mind that the sutures we looked at in the skull, where all of those different parts of the skull met, are technically joints. They are synarthritic joints, and they are dense fibrous joints. They don't really allot any movement, so we're not going to look at them as if they were the synovial joints, the freely movable diarthritic joints. The only diarthritic joint, the only freely movable joint we'll be looking at in this lecture is this one right here, the jaw joint here, what we call the temporomandibular joint, which is formed by the condyle of the mandible and the mandibular fossa of the temporal bone of the skull. So the condyle that we just saw, that little rounded knuckle part, articulates with a little fossa on the temporal bone called the mandibular fossa. So some things to note about this joint here is the movements. One, we do have elevation and depression. So we'd have, obviously our jaw can come down, right, for depression, and then it can lift up for elevation. That would be us chewing. We can also get this sideways movement here, this which we call lateral deviation. Our jaw can also jut forward, so we can jut it forward like this, called protraction, or we can take it back for retraction. So that protraction would be the underbite, and then retraction would be that overbite there. And those are the movements. Now, keep in mind that there are articular discs in this joint as well. And that's usually one of the structures that gets complicated or compromised during temporomandibular joint dysfunction, TMJD, which is a pathology we'll look at here in a little bit. So like we said, the only joint we're actually paying attention to is the temporomandibular joint, which is formed by the condyle of the mandible, articulating with the mandibular fossa of the temporal bone, which does elevation, depression, lateral deviation, and protraction as well as retraction. So that's going to do it for our video today. Stay tuned for the video on the muscles. I'll see you next time. Thank you.